Philippines is taking part in a study for potential COVID-19 treatment options. Now, international health experts are saying the world is, quote, weeks to months away from finding the cure for this mysterious disease. In a town hall meeting with CNN, the World Health Organization says they're closely monitoring hundreds of drug trials, but they don't know yet which ones are working. Let's hear now more from Dr. Socorro Escalante, the acting World Health Organization representative in the Philippines. Dr. Escalante, thank you so much for joining us. The Philippines is part of the solidarity trials of the World Health Organization, and the W.H.O earlier this week said it could start as early as today. Has it started, Dr. Escalante?
Good evening, Rico, and thank you so much for inviting WHO to be a part of this discussion tonight. So the Solidarity Trial is an initiative of WHO to find in a very short period of time effective and safe cure for COVID-19. So under the trial, we are testing 4 types of medicines against the standard treatment that are available in countries. And this includes the anti-malarial drug chloroquine or hydrochloroquine. Then we have the remdesivir, also a new antiviral drug, a combination of the lopinavir and ritonavir medicines, which are used for HIV medicines, and lopinavir and ritonavir plus interferon. So we are very glad that the Philippines has joined this clinical trial where around 100 countries are already participating. And the memorandum of agreement between the WHO and the government of the Philippines has been signed. The Philippines is just waiting for the WHO to ship to the country the stocks for the medicines for the medical trial, so the Philippines can start for the clinical trial, so that the Philippines can start the clinical trials as soon as possible.
So, Dr. Escalante, when will these clinical trials start in the Philippines? Could it be as soon as next week? And for how long would it last?
Sorry, Rico, can you please repeat the question? I'm getting it very choppy. I apologize.
When will the trials start in the Philippines, and for how long will it last?
So it would hopefully start again within the month, again depending on how soon the shipment and the importation of the medicines will start, but will arrive rather. But we hope to be able to start before the end of April. We are looking into a trial of maybe shorter than a year. Because the more countries and the more hospitals are going to participate, then the lesser the period of the trial. So for now, we are looking at less than a year to complete the trials over.
All right, that's quite some time, less than a year. But if we indeed find a vaccine or a cure, Dr. Escalante, will this cure be readily available to the Philippines once proven effective?
So, Rico, for the vaccines, there are also a number of vaccines in the pipeline, but the research and development as well as the clinical trial for vaccines would take a longer time. And the expectation would be at least 1 year or maybe 1.5 years. So we know that the US is already undertaking a clinical trial phase 3 for some of the vaccines. For the Solidarity trial for the medicine, on the other hand, usually the clinical trial for medicines takes years, but in Solidarity trial, 80% of that time will be reduced.
Doctor, briefly, before we let you go, the government has extended the ECQ until May 15. Based on the data that you have seen and know, Is the country headed in the right direction?
Rico, we see over the past few weeks that the number of infections that are reported per day is actually on a more or less flat. However, we are very, very cautious as well because we still see new infections that are occurring. So we are very confident that the government is doing the right approaches in terms of uh, implementing and enforcing public health interventions. But again, this is a very new disease. It's an outbreak that there are many unknowns. So, and then the continuing new infections will still become a concern. So we continue to work hard with the government to identify where those infections are coming. And if we are able to do that in partnership with the government and all the other sectors, then the earlier that we are going to be able to suppress or stop the spread of the infection. So in this very crucial moment that the extended community quarantine is still in place, this is really important window of opportunity where everyone would need to help each other, including the public, to be aware of how this virus is going to be transmitted, and so that we could take the precautions.
Dr. Socorro Escalante from the World Health Organization, thank you so much for your insights and happy weekend.